Well, hi, Holly. This is Cherie, and I just want to introduce you to Heather Kitterman, who is a psychiatric mental health nurse practitioner here in Portland. And I call on this office, and I was so excited when I walked in the other day, and she came out, and she had such a great story personally about Epiduo that I wanted to have her tell you in her own words. So, Heather, let me turn the time over to you and share your experience with Epiduo, if you would.
Great. Yeah, thank you. So for years I struggled with cystic acne. I was successfully able to kind of control it with oral contraceptive pills and different, which I used for quite some time. About a year and a half ago, I was in a pretty serious automobile accident and I had developed a blood clot in my lower leg. Subsequently, I can't take oral contraceptive pills anymore, and so my acne started re-emerging. And I was talking to some of my colleagues here at the clinic about my acne struggles, especially being a professional 36-year-old, working, trying to, put on a professional face. And my colleague recommended Epiduo. She just handed me the kit, which contained the Cetaphil cleaning solution and the moisturizer, and I went home, and within a couple of days, I would say maybe 2 to 3 days, I noticed that my skin started clearing. Since then, I love Epiduo. I try to tell everybody about it, even when I didn't have insurance coverage yet, and to get a prescription was over $300. I paid out of pocket for it because it was so worth it to me. And even though occasionally I'll still get some breakouts, especially during my menstrual cycle, it's nowhere near the way it used to be, and the duration does not last as long. My face does not dry out. I don't have any redness or irritation. I just put it on before I go to sleep at night, and it works beautifully. And so when I heard Cherie was here talking to the provider about Epiduo, I was in my office and I heard it out of my ear, and I ran over and I'm like, I love your product. And I recommended it to another colleague of mine who has a teenager who is also struggling with some acne. And so I love this product so much. It's tremendous for my self-esteem. Like I said, I'm a 36-year-old professional, and to have cystic acne is quite unfortunate, and it just helps me to feel better about myself, especially when I'm meeting with clients. And yeah, I can't speak highly enough about it. So I'm very happy to give you this feedback. And please feel free to contact me if you have any questions. And thank you for making a good product.
Well, thank you, Heather. And I think you mentioned when you talked to me that you said, your self-esteem was so low when you had your acne, and it was really becoming a problem. Could you speak a little bit about that? Because I think sometimes providers don't understand how acne can really affect our self-esteem, being with the public.
Absolutely, absolutely. I mean, again, when you're a teenager, it's difficult. Just your body's changing, hormones, self-esteem is very tenuous at that time. But being a 36-year-old professional, I sort of felt as though this isn't fair, so to speak. Why should I have to be struggling with this? Being a 36-year-old professional who's also starting relatively new in the career that I'm in, where I'm constantly interviewing people, and people summarize me based on my appearance. And so if I don't put forth a professional appearance, whether I like it or not, the acne kind of counts as points against me, and I'm very acutely aware of this. And I was very well controlled with Differin and the oral contraceptive pills. However, now that that option was taken away, I really felt very stuck, and I felt as though my options were extremely limited to possibly Accutane. However, knowing the side effects of Accutane, I did not want to go down that route either. And so not only was the acne affecting my self-esteem, but also feeling as though I didn't have very many options affected my self-esteem, and just feeling stuck and spending hundreds of dollars on different cleaning solutions and different types of makeup, and buying exfoliating treatments and just everything. It's almost as if the Epiduo was presented to me and everything else I have probably close to thousands of dollars of products in my trash can now because I don't need to go down those roads anymore. And yes, I can put forth a face when I'm meeting with clients that I feel professional and comfortable, and I don't feel as though I'm being singled out or judged, because for better or worse, in our society, having acne is not very well received. And so I'm just so grateful that I have a treatment that is accessible, that doesn't have the horrible side effects like Accutane does, and that I can take safely, and my skin responds really well to it. And so I have a lot of gratitude for that.
Well, thank you, Heather. It's so nice to hear from a patient who has struggled with acne and what Epiduo has done for them. And I would like to take you with me wherever I go, and you can give your own personal story, because clearly there are so many patients that will benefit, and it's so wonderful that a company like Galderma really puts the patient first.
Oh, absolutely.
And wants to make sure that they can be healthy and happy. And so thank you so much for sharing your story. I look forward to hearing more experiences if you interact with other people that find that Epiduo has been as positive for them as it has for you. But thank you so much for taking this time to do this. Really appreciate it.
My pleasure.
Bye-bye.
Thank you.